Welcome back, viewers. So we continue to get you these stories of Indians who have made us proud, and they are proud to be Indians. So some dream for themselves, viewers, and some of them continue to push their dreams despite the adversities.
The next story, Rakshita, is of a couple,
Yes.
Dr. Abhay and Rani Bang, who've dedicated their lives to tribal healthcare, and they've been doing it for almost 40 years now. That they've made an impact in many tribal areas. Here is the story of Dr. Abhay and Rani Bang.
4 decades from now, in 1986, a doctor couple chose to serve where healthcare seemed a distant dream, the tribal district of Maharashtra. Both had earned their masters in public health from Johns Hopkins in 1984 and returned home to serve in Gadchiroli. They founded SEARCH, the Society for Education, Action and Research in Community Health in the district. Here, Dr. Rani Bang performed the district's first cesarean delivery. Together, the couple initiated a home-based newborn care program, becoming the national program of the Government of India, training young people in village to diagnose pneumonia, manage sepsis, and save lives at the doorstep. The results speak volumes. Infant mortality fell from 121 to just 22 per 1,000 births. Such enduring impact underscores their unwavering commitment to serving the people of our nation. Dr. Abhay Bang is now the chairman of the Expert Committee for Tribal Health, appointed by the Government of India. Their methods are now embedded in national health programs and embraced by World Health Organization and UNICEF. With over 130 awards between them, their journey is a story worth listening to, showing us what it truly means to be a proud Indian.
Okay, so we have Dr. Abhay Bang joining us. Thank you, sir, for joining us here. And we've been reading about your work, the work that you and your wife do, Rani ji. And first of all, tell us, I think it's 40 years ago that you decided to dedicate your life to tribal healthcare. Why did you decide to do that? And tell us a little bit about what you've been doing essentially with them.
Well, this is very common question, that why did we go to Gadchiroli after coming back from the US? I can attribute it to 3 things. One is, I grew up in Mahatma Gandhi's ashram and the atmosphere of Vinoba Bhave and Jai Prakash. So that gave me social orientation. At the age of 13, when my brother and I were passing through a village where the situation was extremely bad, both of us thought that let's decide what do we want to do in life. And my brother said he'll improve the agriculture of rural India. So I said, okay, I'll improve the health of rural India. So that has been my dream since the age of 13. It was almost like tryst with destiny that Nehru made on 1947, 15th August. We two brothers made tryst with destiny that we will improve agriculture and health of rural India. So when Rani and I did my MDs in India, studied in the US, and after coming back, we chose Gadchiroli, which is the most backward and remote district in Maharashtra. 5 lakh tribals live there. Tribals are worst affected and most neglected section of population in India. There are nearly 11 crore tribal people live in India in different parts. But we educated people living in urban area, and even the policymakers, as if we are hardly aware of their existence. We sometimes see them in only movies dancing with fancy dresses. But tribal people have worse social status, worse health status. They have little access to healthcare. So Rani and I thought that we should go where the challenges are and not where facilities are. Everybody wants to go where the facilities are, lekin usme kya fun hai? So let's go where the problems are so that we can contribute a little bit to solving the problem. And that's why 40 years ago, We chose to came to Gadchiroli, and that's it.
Yeah. I mean, you and your wife are both graduates of the Government Medical College in Nagpur, and both of you graduated and worked with Johns Hopkins University in Baltimore, USA. So, for you to come back and dedicate your entire life to this, how did you go about setting up a mechanism to help them in the jungles when you had no help?
I must tell you one or two stories because things happen through stories. And when we came, we wanted to give healthcare to tribal people. So we assembled people from 50 tribal villages and we asked them that why don't you go to modern medicine? Why don't you seek care? So they said कि हमको अस्पतालों का डर लगता है. क्या डर लगता है? तो बड़ी बड़ी ऊंची बिल्डिंग्स होती हैं, हम उसमें खो जाते हैं और वहां पे लोग सफेद कपड़े पहन के घूमते हैं, एप्रन्स. तो हमने पूछा कि सफेद कपड़ों से आपको क्या डर है? तो उन्होंने कहा हम तो मुर्दों को सफेद कपड़े में लपेटते हैं, यहाँ तो जिंदा डॉक्टर ही सफेद कपड़े में लिपटा है, वो क्या बचाएगा? और वहां पे गिटपिट भाषा बोलते हैं, इंग्लिश, वो हमको समझती नहीं है. और वहां पे मरीज को अंदर रख देते हैं, लोगों को, रिश्तेदारों को बाहर भेज देते हैं और वहां पे भगवान नहीं है, इसलिए हम वहां नहीं जाते हैं. सो keeping all those things in mind and keeping to overcome these barriers that tribal people mentioned, we decided to construct a hospital which will be a tribal friendly hospital, which will look like a tribal village where a tribal will not feel intimidated, alienated, but he will feel as if he has come to his own village. So we designed a hospital of huts. There were several huts. Patients were kept in the huts with relatives so that patients were not isolated from relatives, and doctors and nurses used to go to each hut. We had our outdoor clinic, which was like a joint family house of a tribal with a gond structure called gotul. So the design of the hospital was tribal friendly, and at the entrance, we erected a temple of their gond goddess, Maa Danteshwari. So tribal people said, we want to name this hospital as Maa Danteshwari Davakhana, and that's what our hospital is called. And that's how we tried to overcome the barriers, and tribal people should seek care from us. Now, second instance, that it happens with everybody, same happened with us. We were fresh from the US, and our MDs in India and the education in the US, of course, give modern ideas to you. So when we came, and a tribal girl, 8-year-old tribal girl was sent to me as a case of heart disease. On examination, I felt that she probably had sickle cell disease. And so when we established the test, yes, she proved to be sickle cell disease. I thought that I have discovered the first case of sickle in the district. And so in that enthusiasm, we conducted a survey of tribal people and found that 15% people had sickle gene, but less than 1% really had sickle disease. Now, when government did nothing, I got award, my first award for this, we got research publication, but no action. So we went back to tribal people to tell them that, look, they should raise their voice and ask government to do something about sickle cell disease. तो आदिवासियों ने हमारी ओर ब्लैंकली देखा और कहा, डॉक्टर साहब, हमने कभी आपको कहा था कि सिकल हमारे समस्या है? आप आए, आपने एक बूंद खून मांगा, हमने सोचा डॉक्टर दंपति है, इनको क्यों निराश करें, हमने आपको एक बूंद खून दिया. ये बीमारी हम जानते नहीं है, इससे हमारा लेना देना नहीं है, आपने खोजा तो आप ही सॉल्व करिए, हमारे पास क्यों आया है? So we realized that we had done a capital blunder, that we had imposed our curiosity, our research ideas on the tribal people, and that's why they disowned what we were telling, that there was a sickle problem. They didn't have that problem as the priority. तो भैया गलती की, माफ करो, अब उल्टा करेंगे. हमने 50 गांव के आदिवासियों को बुलाया, ट्राइबल हेल्थ असेंबली बुलाई और उनको कहा कि आप अब हमको बताइए कि आपके कौन सी हेल्थ प्रॉब्लम आपको ज्यादा तकलीफ देते हैं, उसके लिए हम कुछ करें. शायद ये दुनिया में पहला ऐसा कभी हुआ होगा कि गांव-गांव के लोगों को इकट्ठा करके रिसर्चर ने उनको पूछा कि आप बताइए हमको रिसर्च एजेंडा, किन चीजों पे आप हेल्थ रिसर्च चाहते हैं जो हम करें। और आदिवासियों ने जो 6 हेल्थ प्रॉब्लम्स बताए, उसमें से एक था हमारे बच्चे मर जाते हैं, आप कुछ कर सकते हैं। दूसरा प्रॉब्लम था औरतों में कमजोरी है। तीसरा था अल्कोहल और अल्कोहलिज्म। चौथा था बैकेक, कमर में बहुत दर्द होता है, और मलेरिया और डायरिया। 6 उन्होंने दिक्कतें बताई। और इसलिए हमने उसके बाद में 2 चीजें की। एक, इनमें से सभी चीजों पे हमने स्थानिक रिसर्च किया। वो जो स्थानिक रिसर्च किया हमने, वो लोगों ने जो प्रॉब्लम बताया उन पे किया। उस रिसर्च की 2 खासियतें थी। One was that it was always involving people and giving solutions in the hands of people. These were not solutions where we compelled them to come to hospital. Tribal people, a sick child, a sick mother cannot come to hospital. So the solutions must be ultimately given in the hands of the tribal people, rural people, in the form of, we designed a program which was community health worker based, and that program showed that first, ordinary woman can diagnose childhood pneumonia. अब अक्सर तो न्यूमोनिया हम डॉक्टर लोग स्टेथोस्कोप से डायग्नोस करते हैं, एक्सरे लेते हैं, सीटी स्कैन लगते हैं, लेकिन ये सिंपल इक्विपमेंट मैंने बनाया जिससे एक देहात की अनपढ़ औरत भी, जिसको 50-60 तक गिनना नहीं आता है, वो न्यूमोनिया डायग्नोस कर सकती है। बच्चे को खांसी है, सांस तेज चल रही है, सांस गिनो, सांस गिनने के लिए 1 मिनट साइन टाइमर है, और 10 तक तो गिनना आता है। 10 गिनने के बाद ये मणि आगे हटाओ। अगर सांसें 60 तक पहुंच गई तो ये न्यूबॉर्न में निमोनिया है, और 1 साल के बच्चे में अगर सांस 60-50 तक पहुंच जाती है, लाल मणि हिल जाता है, तो निमोनिया। अब इस सिंपल इक्विपमेंट से जब अनपढ़ औरतों ने, दाइयों ने न्यूमोनिया का निदान किया, वो 82% डॉक्टर के निदान से मैच हुआ। तो ये एक पहला हुआ जिससे हमने न्यूमोनिया से मरने वाले बच्चों को बचाया। ये हमारी न्यूमोनिया के ट्रायल लैंसेट में प्रकाशित हुई और बाद में ग्लोबल प्रोग्राम का आधार बना। अब बचे हुए जो बच्चे हैं वो न्यूबॉर्न बच्चे, सबसे ज्यादा मृत्यु भारत में और दुनिया में आज जो होते हैं वो न्यूबॉर्न बच्चों में होते हैं। न्यूबॉर्न बच्चे बहुत कमजोर हैं, लेकिन डिलीवरीज घरों पे होती थी, और जब बच्चा सीरियस हो जाए न्यूबॉर्न तो किसी को पता नहीं चलता, घर से बाहर ले जाना भी अलाउड नहीं था, और ले जाए तो जाए कहाँ, कोई जगह नहीं है जहां न्यूबॉर्न को ले जाए। नजदीक हॉस्पिटल 200 किलोमीटर दूर था। तो फिर से हमने मेडिकल साइंस को पलटा दिया कि अगर न्यूबॉर्न बच्चे हॉस्पिटल तक नहीं आ सकते हैं तो हॉस्पिटल को घर घर जाना पड़ेगा, जहां न्यूबॉर्न है। और एक होम बेस्ड न्यूबॉर्न केयर नाम का हमने प्रोग्राम विकसित किया, जिसमें नियोनाटोलॉजी की साइंस और ताकत गांव की मां को, और गांव में एक प्रशिक्षित कम्युनिटी हेल्थ वर्कर, उसको दी गई। उसका भी हमने कंट्रोल फील्ड ट्रायल किया 3 साल का, और उसमें पाया कि इस ढंग से जब घर घर में न्यूबॉर्न केयर गांव की औरतों द्वारा दी तो न्यूबॉर्न मोर्टेलिटी 70% से कम हुई, और इस इलाके का चाइल्ड मोर्टेलिटी रेट जो 121 था, इन्फेंट मोर्टेलिटी रेट, वो कुछ सालों में 30 पे आ गया, और अब तो 16 पे आ गया है। तो चाइल्ड हेल्थ की एक रिवोल्यूशन कर सके, जो बाद में ये जो हमने होम बेस्ड न्यूबॉर्न केयर का प्रोग्राम मैंने कहा, ये हमारा लैंसेट में पब्लिश हुआ, भारत सरकार ने इसको स्वीकार किया, और पूरा नेशनल प्रोग्राम में इसको अंतर्भूत किया गया। पिछले साल 10 लाख आशाओं का, जिनको होम बेस्ड न्यूबॉर्न केयर में ट्रेनिंग दिया है, उन्होंने 1.5 करोड़ न्यूबॉर्न गांव में पैदा जो हैं पिछले साल हुए, उनको होम बेस्ड न्यूबॉर्न केयर दी। तो भारत के करोड़ों बच्चों को इससे हेल्थ केयर पहुंची, और लाखों इससे बाल मृत्यु हर साल कम हुए। ये इसलिए संभव हुआ कि हमने समस्याएं लोगों की क्या है जानी। पहली गलती तो की थी, अपने दिमाग की समस्या लोगों पे थोपी थी। अब उल्टा किया, लोगों ने जो समस्याएं बताई उस पर हमने ऐसा रिसर्च किया कि सत्ता, हेल्थ पावर, ये लोगों के हाथों में जाए, ताकि लोगों को डॉक्टर पे, अस्पताल पे निर्भर न रहना पड़े, क्योंकि डॉक्टर अस्पताल बहुत दूर हैं इसलिए, और लोग अपनी स्वास्थ्य समस्याएं खुद सुलझा सके। इस मॉडल को हम कहते हैं आरोग्य स्वराज। आज हमको स्वतंत्रता दिन है हमारा, We got our freedom today. But if freedom doesn't mean that only political freedom. We need freedom in every sphere of life. Freedom from disease, freedom from dependence, even freedom from dependence on drugs, diagnostic and doctors. Not in a negative sense, but people should be able to take care of their own health as much as possible. And only in very severe cases, they would need doctors and hospital. तो तरीका हमारा ये है कि लोगों के प्रॉब्लम पे काम करो और सॉल्यूशन ऐसा ढूंढो कि जिससे लोग एम्पावर हो, लेकिन साथ में उसको ऐसे रिगरस साइंस के साथ करो कि वो सॉल्यूशन साइंस में और पॉलिसी में दुनिया भर में स्वीकार हो जाए. बस पिछले 40 साल से हमने गढ़चिरौली में यही किया है.
Absolutely. But the major question is, Dr. Abhay, is that much of the work that you do is a responsibility of a politician, of that of the government. Your work has brought down the child mortality rate in that region from 121% to 30%, and that is the work that you've done. But do you not believe that that is also the work of the local government, the politicians and the government there? The ground reality is completely different. The people like you, they are in fact leading the charge as far as the child mortality rate is concerned.
Look, I don't think it's doctor or social worker versus government. It's doctors and social workers plus government. I don't think that government or whether prime minister or health minister can go to villages and do this kind of health research. But at the same time, once we have discovered a solution, then it is the responsibility of government to incorporate those solutions in national programs and use it widely. So our roles are different, but they are complementary. And that's what Government of India has done. Repeatedly, whatever we discovered here to reduce child mortality, Government of India has incorporated that in the national policies. And there the government has expanded. So from 39 villages where we initially worked, this solution has reached now 6 lakh villages. Not only, now 80 countries have incorporated elements of our solution. So it became from Gadchiroli to global. How? Via service and research, we showed that this problem can be solved. Then the role of government starts to take that solution to every corner of India.
That's one way of looking at it, but it's not easy. I mean, giving up 40 years of your life, dedicating it to tribal, sir, you will say it's completely worth it. And we will say thank you for your service. We're very, very proud of your story and the story of you along with your wife, Rani ji. Give our regards to her as well. Because I just read, an interview where she spoke about her health. And you've spent most of your lives in this region, in forests, in tribal areas, not caring about yourselves, but just their healthcare. Hats off to you, sir. Thank you for your service. Thank you for joining us here on Republic.
Thank you. Thank you.
Thank you very much. Okay, we'll take a short